Skin tightening and fat reduction. These are two things that we often need to try and achieve for our patients. Why? Well, one of the most common complaints is laxity, sagging in the lower face, loss of definition of the jawline, jowls, marionette folds, sad downturn look of the mouth, and of course laxity in the neck and sometimes a heaviness of the neck because fat cells do expand and get bigger in the neck area, and so we do sometimes have to reduce that fat down. So that's how what we need to target. What can we use to do that? Well, I want to introduce you to, if you've never heard of the Endo Define, a fantastic laser that's given us some amazing results in clinic. Now, the Endo Define, as all lasers, has a certain wavelength of energy, and this is 1470 nanometer wavelength. What does that mean? Well, with pretty much every laser, it has a specific target, something called a chromophore, something that is going to preferentially absorb that energy, that wavelength. And the target in this case is water. 1470 is a great wavelength to target water. And why do we want to target water? Well, you may know water is in all our cells, which means we can then have a very profound effect on all the cells of the skin. And if we want to, we can also target the fat cells, meaning that we can liquefy the fat and also reduce that down if we wish to. That, of course, then is influenced by what settings we use on the machine, and that's where the practitioner's experience comes in to ensure that the right settings are used, the right protocols for the area, the patient, and what we're wishing to target to ensure we get maximal results, but without causing any undue risk to the patient. So how is it actually done? Well, we would first of all, after a consultation and all the pre-procedure prep, and there is a fair bit done with procedures like this, we treat it almost like you're having surgery, even though you're definitely not. And then on the actual day of procedure, you know exactly what's involved, a bit like if you're going for a surgical procedure, and you already have your pre-care, aftercare, and so on. So if you haven't had a thorough, separate consultation, ideally a couple of weeks minimum before your procedure, and you haven't had all that information and all the risks and benefits explained to you with a really careful assessment, then you may not be at the most appropriate place to have it done. Once that's in place, on the day, photographs, consent form, etc., and then you would typically be marked out of where we're actually going to treat. You would then have something called tumescent analgesia infiltrated through the skin. What does this mean? Well, you'll know local anaesthetic, you might have had it at the dentist or for a procedure, and this a special solution is then introduced in actually a fairly comfortable way. It's not lots of needles. We're actually using something called a microcannula, fine cannula, to introduce this safely and fairly quickly throughout the target area. Typically it's the lower face and neck, but it might be somewhere else. And this takes about 20 minutes or so to do. Once that takes effect and we mix the solution in a way that it doesn't really sting when it goes in, you're then actually really not going to experience any discomfort. And I've had patients fall asleep during the procedure. I've certainly had patients drift off into semi-sleep, and they really are surprised at how little, if any, discomfort they've experienced. When we start the procedure, we set it all up. This would be plugged into the machine, and the actual fibre is so thin that you can probably barely see it next to my finger. So this is really, the diameter of a thick stubble of hair. And of course, there are different diameters for different areas, but typically it's around 0.3 to 0.4 millimeters in diameter, so very fine. Why is that so important? Well, the fantastic thing is that when this is engaged, the laser is engaged and it goes into the skin, and of course it has to be on for it to make a hole in the skin. You can see now it won't go in. Once you do the procedure in that area and take the wire out, you can usually not even see where the wire went in the first place. That's how small the hole is and the injury is. If we're creating minimal injury on the surface of the skin, it means you've got minimal risk of having any marks or scars or any issues. So people of my skin type are particularly prone to getting things like hyperpigmentation or other marks that can persist sometimes for many months or even up to a year after. I've done this procedure on many people of Indian or similar skin, and actually typically on this area we don't see any issues. Of course, we, as always, give them the Solderma GF5 serum to ensure that that risk is kept to a minimum. So that's the really nice thing. You can't really see where we've been, and you can go in at multiple entry points as much as you need without that issue. Once it's in and it's running under the skin, yes, it might not be a nice thought, but remember, you're just feeling something happening. You're not feeling pain. And as it travels through, you can actually hear a bit of a crackling noise. Now, I tell people to embrace this noise because actually what it's telling us is the energy is being received by the tissue and contraction is happening, things are happening. And if you've not seen videos on this, it's really interesting to watch The light shows you where the wire is traveling, and it's really, really, really interesting. Now, once we've finished the procedure, which typically for a lower face and the neck may take, once the anaesthetic's been done, around 45 minutes or so, maybe up to an hour, depending on how much we've got to do. We'll then just do a little bit of aftercare with the Saldoma GF5, and then typically provide you with a supportive surgical garment, so used after surgery. It's a similar thing, and that will just help minimize the degree of swelling that you have and bruising that you have after the procedure. Some people are lucky and they walk away with zero bruising, and of course occasionally people will get 1 or 2 juicier bruises. And the swelling typically will last for maybe 3 or 4 days. But again, everyone is different, and it's really important when you go into these things to understand that every person is going to be different to the next, and always allow a bit of leeway with the times we give for healing and downtime. In terms of going back to work, it depends what you do, but if you're doing an office-based job or you're working from home, I would say beyond a day or 2, most people feel happy to resume their work duties. Many people will actually go and work the very next day and be fine with it. We treated our clinic manager at one point, and she was actually at work the next day carrying on, had a bit of bruising, and was even at our staff party 2 days later. Clearly there are going to be certain warnings and precautions that we tell you to take in terms of exercise, alcohol, steam sauna, sunbeds, but all of that will be provided to you by your practitioner well in advance, so you know what to expect. So what we can achieve with this laser guided technology is potent, powerful skin tightening through collagen, elastin and other structural protein production, as well as, if needed, fat reduction. We're not aiming for surgical results, but what we are doing is giving someone a non-surgical option for getting quite powerful improvements in a given area. But also, an advantage over surgery is that we're actually improving the quality of the skin. With surgery, we're cutting, hoisting, and yes, we can have fantastic results, but what we're leaving behind are the same aged and damaged tissues being skin and underlying layers. But with this, we're not cutting away anything. What we're saying is we're triggering the body to actually go into a regenerative and repair process, thereby reversing the architecture of the skin, and therefore actually even the function of the cells and how they're behaving, thereby giving you a healthier, more aesthetically pleasing contour and profile to your face, neck, or wherever we happen to be treating. So if you have any questions or comments, do drop them below, and of course visit the Perfect Skin Solutions website if you want to learn more about the amazing Endo Define.